Hello class! This week we're going to start our unit on paternalism and patient autonomy. And in this video, I'm just going to give you a general introduction to the topic. This is going to supplement part of your reading for this week, pages 71 through 76 in the Vaughan textbook. So let me just start with a definition of paternalism. Paternalism is overriding a person's actions or decision-making for that person's own good. So let me give you an example of what I'm talking about. First I'll start with a non-medical example, and then I'll give a medical example. So the non-medical example. Imagine that you're a cashier at a liquor store, and your friend comes in to buy a six-pack of beer. But you know that your friend used to be an alcoholic, and he's been clean for 6 years now. So you decide to not sell your friend alcohol. And your friend says, why not? I've had a hard day, I just want a six-pack. Look, there's no harm done. And you say, look, you've been doing so good, you've been clean for 6 years. If I sell you this alcohol, who knows what'll happen? You might start drinking really heavily again, and your life might get out of control. So in this case, you have interfered with your friend's ability to make decisions for himself. You're disrespecting his decision-making capacities. You're overriding his decision-making for your friend's own good. You're not just doing it because you're a control freak, because you think you need to make every decision for every person. No, you're doing it in this particular case because you're concerned about your friend. In this case, you're prioritizing your friend's well-being over his ability to make decisions. Now, it might be the case that he just goes on down the street and buys, a six-pack at a different store. But the point is that in this particular case, you have interfered with his ability to make decisions. And that's a form of paternalism. You're doing it for your friend's own good. Okay, let me give you a medical example now. Imagine that you're a doctor and that you've been treating a patient in a hospital for a year now. And this patient is on life support. She's conscious, but she's on life support. If everything goes well, she'll be out of the hospital within a year. She's recovering. However, she's in a lot of pain. And one day, she tells you, I'm in so much pain, I'd appreciate it if you just unplugged me. Take me off life support. And you say, but if I take you off life support, you're going to die. And she says, I know, but I'm in a lot of pain, and I'd appreciate it if you just respected my decisions here. And you said, you know what? No, I'm not going to respect this decision. You're just having a bad day. This is the pain talking. You're getting better. You like your life. Okay, you're just having a bad day. I'm going to keep you on life support. In this case, again, you are acting paternalistically. You are thinking about the patient's well-being, and you think that this patient is making a poor decision. And you're prioritizing your patient's well-being over you're respecting that patient's ability to make decisions for herself. Now, in most cases, you might think, yeah, of course I should respect patients. If a patient wants to make a particular choice, a patient wants to go with treatment A as opposed to treatment B, normally I'll respect that. But in this case, I think it's okay for me to disrespect this decision because I think her well-being is much more important than my obligation to respect her decision-making abilities. So this is a form of medical paternalism. Both of these cases are paternalistic. Whenever you prioritize someone's well-being over their ability to make a particular decision, and you override that decision for their well-being, that's acting paternalistically. Now, there are multiple issues as well. These aren't the only types of cases that we can talk about in medical paternalism. We're also going to talk about how do we determine when a particular patient is autonomous or not? So is a 17-year-old autonomous? Do we have an obligation to respect a 17-year-old's ability to make medical decisions for herself? This is one of the cases that we'll go over this week. What about a schizophrenic patient? If a person has severe schizophrenia and they refuse to take their medications, is it okay for us to somehow force that person to take medications? Perhaps they're not autonomous enough to make their own decisions. So what do we mean by patient autonomy? How do we determine when a patient is autonomous enough to make their own decisions? Okay, so, one more thing I wanted to talk to you about briefly. There are two types of paternalism. There's strong paternalism and there's weak paternalism. Weak paternalism has to do with, well, first of all, cases involving children and people who are severely who have severe psychiatric problems. But there are also people who are unconscious, so people who are in comas. When we make decisions for those patients, we don't let them make their own decisions. That's known as weak paternalism. But when we override the decisions of a fully autonomous being, a normal human adult being, wants to do one form of treatment and we deny them the ability to make that treatment decision, that's strong paternalism. Okay, as always, if you have any questions, feel free to ask. The next 2 videos this week will be on the argumentative articles. Okay, have a good day.